She sat across from me with tears in her eyes in my office, and sitting next to her was her 90-year-old mother. Lovely woman, silver hair, elegantly dressed, witty. And she says to me, "Doctor, we don't know what to do. You see, my mother lives in a beautiful facility. However, I'm getting calls every night because she's in pain, and they don't know what to do for her. I don't live in the area. I've flown down to try to get her help." I go to the woman and I say, "Ma'am, how can I help you? What's going on?" And she says, "It's my shoulder." She said, "The facility is very lovely, and the people are so kind, and the activities are so lovely, and I want to dance, but I can't because of my shoulder. All I want to do is stay in bed. It hurts so badly." I look at the medication list. She's on oxycodone 3 times a day. She's on Ambien for sleep, and a list of other medications, heart, lung. I stand up, put my hand on her shoulder. She yelps in pain. I try to gently range her shoulder. Crack, 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 crack. Seriously, I have never experienced anything like this in my 20-plus years of practice. It sounded like literally her shoulder was disintegrating. I reached for my ultrasound probe, placed it on her shoulder to look inside. No identifiable landmarks. "Ladies, we're going to order an MRI." The radiologist calls me and he says, "This is the worst shoulder I have ever seen." He goes on to recite a litany of abnormalities. Of course, it's riddled with arthritis, deformities, subluxation, and oh, by the way, I can't rule out some type of a synovitis that I had not heard of. So you see, I had a decision to make. What was I going to offer this lovely 90-year-old woman? The problem is, the week prior, I had been referred a woman for shoulder pain by the local orthopedic surgeon. She was in pain for her shoulder, but she had maxed out on her opioid medications. So this was about 8 or 9 years ago, and I had been studying and reading about regenerative medicine and PRP. And I was excited. And I said, "You know, there's something called PRP, platelet-rich plasma. We can use your body. We can heal you. It's non-surgical. It's right here in the office. No hospitalization, no downtime, pain relief, and we can get you off of your medications." She had returned to tell me she discussed it with her surgeon, who adamantly advised against it. "And by the way, doctor, he called you a quack." A quack. And so immediately, fear starts to come in my brain. Fear, because I was new to these treatments. Fear of my reputation. Fear. He had been a good source of referrals for me, and I didn't want to be called a quack again. He was affiliated with the Los Angeles Lakers. We had talked about sharing office space together. I didn't want to be characterized as a snake oil salesman. Fear. But then I remembered my story, because you see, I grew up with chronic pain. As a child, a young girl, a medical student, a resident. Chronic pain, back pain because of scoliosis that was missed as a child. And I had been in this woman's seat many times, told that there was nothing that could be done for me. And by the way, you're just going to have to live with your pain and don't have children because your curve can progress. As a PM&R resident, I studied hard and I applied the principles to get myself out of pain. And today I have 3 adult sons. I'm extremely active. I hike, I dance ballet, and I have no pain. So I knew I had no choice but to treat this woman. Even though she's 90, I don't know how much life she had left, but I knew that she deserved to have quality of life. So I explained the treatments to her and her daughter, and I proceeded and I administered shoulder PRP for her. A couple months later, she returned, and I said, "How's it going?" And she flailed her shoulders and said, "Look, doctor, I'm belly dancing at the facility." And her daughter was no longer getting those calls about pain. And that patient that did not take my advice about PRP, she went on to have shoulder surgery. And unfortunately, she had a complication resulting in a revision and an increase in her opioid medications to manage that pain. Medicine has been lulled into submission. We are spending time clicking off our check boxes, right? We are shuffling authorization forms. We're on the phone with the insurance company. If the health plan does not authorize treatment for our patients, they might not get the treatment. And just as tragic, we're beaten down. It's easy for us to throw in the towel. We might not even discuss new treatments or even offer them. The things that the research that has excited us here at this meeting, discussing it with our colleagues, the exhibitors and the exhibition things we've seen in the assembly hall, our patients may not even know the latest advances that we are making in medicine. So you see, we owe it to our patients. We owe it to society to create, to innovate, to dream big, think outside the box. And isn't that what PM&R is all about? Isn't that what we were founded on? We are innovators, we are the first. Our specialty is perfectly suited for this because you see, we are scientists, not merely technicians or healthcare practitioners, healthcare providers. We are scientists. And it always hurts me when the exquisite art of diagnosis is minimized and reduced to making a medical decision solely based on an abnormal MRI finding or the lack of, or an x-ray or a lab. And my students, often I'll chant to them, "We treat people, not MRI findings. We treat people, not MRI findings." It was last year. I had the honor of meeting Darren Kavanoki, an extreme athlete, he described himself. He told me his history. And then he's an attorney, a busy attorney, running his firm of about 30 to 40 attorneys. And also at the same time, he would host his TV show that he created called Deadly Sins. But he came to me because he was battling chronic back pain for years. He had tried everything, over-the-counter medications, physical therapy, acupuncture, creams, yoga, you name it. 9 epidurals over the past 3 years, which were waning. They were not working. And in fact, he had seen the largest and one of the most popular orthopedic groups in our town. And they had said that you need to have surgery. And he actually was on the surgery schedule as he sat in my office. "Yep, you're the last stop before my date with the scalpel," he yelped. And in fact, the only reason why he had not already received surgery is because the pre-op labs had a slight abnormality, and so they had postponed surgery. He saw it as a sign from heaven. So he was referred by a friend of a friend, who happened to be a pharmacist, that said, "Go see this doctor." So that's what brought him to me. I listened to his story, back pain, radiating to his groin, tingling, going down the leg, and his eyes began to water as he's telling me the story. I examined him, looked at him from head, from foot to head, looked at his back, palpated, ranged him as we do as physiatrists. Neurological exam, I looked at his MRI, and he did have a disc at L3. I took a deep breath, smiled at him, and said, Darren, if you are willing to think outside the box, then I have some treatments for you. Have you heard of prolotherapy? Nope. I explained it. Well, I'm in, but I'm warning you, I've got some healthy skepticism. So we proceeded. He came for follow-up after the prolotherapy, and he said, I think I'm feeling a little bit better. But then he dropped the bomb on me. Well, Walgreens Pharmacy, they are setting up wellness kiosks all across the country, from California to New York, and I've been hired as the new face of 50. I'm going to be running 3,000 miles across the country. Isn't that awesome? Yeah, Darren, that's awesome, Darren. When I'm really thinking this is a rated G activity, I'm thinking, oh my God. Oh my goodness. I said, well, okay, Darren, we're going to have to up the ante if you're going to make this trip. 3,000 miles across the country? Really? Have you heard of PRP? Nope. But I'm all in. But I'm warning you, I have healthy skepticism. So over the next weeks to months, he came in. He would assume the position of the prone position, and I would provide spine PRP. He was just as enthusiastic as the first time. And each time he would come in, he would tell me about a new sponsor. Well, Garth Brooks has just signed on, and Mary J. Blige has just signed on. And his confidence never waned, and his enthusiasm never waned. And we're going to be launching from Dr. Phil's. Oh, that's great, Darren, that's great. So launch day came, I gave him my blessings, and I have to be honest, I felt like a mother hen, blessed him, and he went on his way, trekking across the country. We stayed in communication, texting, Texas, Tennessee. And then he called me from New York. I'm like, Darren, you're ahead of schedule. Well, a funny thing happened. Somewhere, I don't know where it was in between, but I developed a shin splint. No back pain, but I developed a shin splint. So I had to discover cycling. I have never cycled before. And I cycled, and I ended up a day ahead of schedule. So Darren was able to make that trip across country, and no back pain, shin splint, cycled. In order to celebrate the end of the contest, there was a giveaway competition, and Darren was able to personally give away a car to a woman. And he asked her, what prompted you to enter the contest? And she replied, you did. Watching your trek across the country signified to me endurance and persistence, because you see, I am a single mother raising my autistic son, and I needed a car in order to get him to therapy. 3 months, this has been 3 months now since this run, and Darren and I laugh about this trip, and he later confessed that this run really wasn't about him being an extreme athlete or his athleticism. No, he battled childhood obesity, and he wanted to be a beacon to others that they could overcome their fitness challenges. Also, as a criminal attorney, he admits, I defend criminals who have done some shady things. I defend criminals who have made poor decisions and they have addictions. And so he said, you know, this run, this journey, wasn't so much about the prize of making it with no pain, but the journey really, again, I want to tell these people that they, no matter what their shin splint is, whether it be your addiction, whether it be obesity, whatever your shin splint may be, whether it be your crime, that you can overcome. And he said with tears in his eyes, that's the true message. And isn't that about life, that it's really not about the end point or the destination? Isn't that what it's about? It's all of our journeys. And when I tell people what I do as a physiatrist, because actually I'm a spinal cord injury physiatrist, people say, how sad? And I say, no, it's quite the contrary. Because we watch our patients on their journey, whether that shin splint may be paralysis or a brain injury, and we watch them grab their bike and cycle, right? They make that modification, they make that shift, and they become victorious. And that's actually what it's all about. So let us learn from Darren's courage, his willingness to think outside the box. And so for this, I challenge each and every one of you today. And for the doctors, I challenge each and every physiatrist today to think outside the box. When you are scared, do it anyway. You have a gut feeling that something may be a game changer for a patient, do it anyway. You have healthy skepticism, that's right, do it anyway. And when you take those bold steps, do it for yourselves, do it for your patients, and most of all, do it for the love of medicine. Thank you very much. Thank you for hanging in there for Sunday. Thank you, honey.